Welcome to AT 24/7, I'm Aaron Dean. An alert for parents: if you are looking to order the new shot to protect your baby against a common respiratory virus this winter, you may be out of luck due to a limited supply. Monday, the U.S. Centers for Disease Control and Prevention recommended doctors reserve doses of the drug Beyfortus. The new therapy against RSV is for infants at high risk and those under 6 months of age with underlying health conditions. One manufacturer said despite planning based on past rollouts of pediatric vaccine, demand has outpaced supply. The CDC also recommended doctors stop using Beyfortus for babies 8 through 19 months of age who are eligible for an older protective therapy called Synagis. Google has temporarily disabled the ability to see live traffic conditions in Israel on Google Maps and the Waze app. It comes as the country prepares for a potential ground invasion into Gaza. On Monday, Google did not say whether the tools would be disabled in Israel, Gaza, or both, or whether the action was at the request of the Israel Defense Forces. But Google says users will still be able to get map routes to specific places and estimated times of arrival. Last year, the tech company made a similar move after Russia invaded Ukraine, when it temporarily disabled real-time vehicle data. On Tuesday, Michael Cohen is expected to be face-to-face with his former boss, Donald Trump, and the former president's fixer is set to testify as part of the New York Attorney General's civil fraud case against the former president. Multiple sources say that this is the first time the two have spoken in about 5 years. Cohen went to jail for tax crimes and lying to Congress. He also previously testified before Congress about a hush money scheme involving women claiming to have had affairs with Trump. In this case, New York's Attorney General is seeking to bar Trump from doing business in the state. Trump is expected to be called as a witness at some point during the trial. Many working Americans are or will soon be choosing their employer-provided health plan during open enrollment. But looking at affordable health care may be tough to do as premiums soar, and many families are facing hundreds of dollars more out of pocket for the same coverage they had before. The Advocate Channel's Laura Aguirre has more on what to consider when making your health plan selection.
The cost of family health insurance is basically the cost of a new car, a new small car, but still a new car.
Matthew Ray co-authored KFF's recent survey on employer health benefits. He says the average annual family plan now costs nearly $24,000, and workers are paying more for their share after their companies foot the rest of the bill.
So to enroll a family of four, on average, you're paying about $6,500. Workers at smaller firms are paying more than $12,000.
Those price points represent an average increase of around $500. For single coverage, the tab for employees is about $1,400 a year, a $75 bump. But Ray does have some pointers on choosing a healthcare plan going forward.
If you anticipate having health needs, if you have chronic health conditions, then you may want to have a plan with lower cost sharing. That's lower deductibles, copays, and co-insurances. Alternatively, if you're relatively healthy, you may want to pay less money up front, and you may want to go for a plan that has a lower premium contribution.
There's also the annual out-of-pocket maximum, and once that's met, most plans cover services 100% for the rest of the year.
If you think you're going to have a big expense of the year with multiple services, then an out-of-pocket maximum will kind of protect you from having huge expenses.
And protection from huge expenses is one choice everyone would like to make. For Consumer Watch, I'm Laura Aguirre.
Well, the world is facing a loneliness problem. According to a recent Meta Gallup survey, nearly 25% of adults in 142 countries have reported feeling lonely. The rates are highest in young adults. The survey found 27% of respondents aged 19 to 29 reported feeling very or fairly lonely. The World Health Organization and the U.S. Surgeon General have warned about the dangers of loneliness. It can have a negative impact on mental and physical health and even lead to early death. To combat loneliness, experts recommend talking to as many people as possible as you go throughout your day. Thanks so much for joining us for AT 24/7. For more, go to theadvocatechannel.com and subscribe to the Advocate Channel YouTube page. For the Advocate Channel, I'm Aaron Dean.